Imagine Dragons frontman Dan Reynolds continues to use his voice and platform to raise awareness of unexplained back pain that could be inflammatory arthritis of the spine called Ankylosing spondylitis, or also known as AS. Dan was diagnosed in his early 20s with this painful condition that can cause inflammation and pain through the spine, including the lower spine, buttocks, and hips. We're catching up with Dan now to talk about the band's incredible success and his role in raising awareness for this unexplained back pain that's known as AS. Joining him is also Dr. Hillary Norton, a rheumatologist who also has AS. Thank you for joining me today.
Thanks for having us.
Thank you.
Now, Dan, Imagine Dragons is coming off another incredible year. Congratulations on all of your success. What projects does the band have coming up for the year 2020?
Honestly, our main project after 10 years on the road is to just reconnect with being a normal human being. So we're all kind of taking a year off. I have 4 kids, a 7-year-old, two twin-year-olds, two twins that are both 2. And I also have a newborn child that's a month old. And I'm obviously underslept, as you can tell, because of the newborn. So yeah, my goal is to just be a dad right now and take a little time off the road and raise awareness about things that I care about, like ankylosing spondylitis.
Absolutely. Being a parent of 4 myself, I totally understand. Congratulations on your latest addition to your family.
Thank you. Thank you so much.
Now, Dan, you do continue to stay busy, but you do still also live with unexplained back pain. Now, how does that impact your daily life in managing the band's hectic schedule and even as a dad?
Yeah, to take you back about 10 years ago when I was first kind of dealing with ankylosing spondylitis, the band was unsigned and very small at the time, and we were trying to hustle to make ends meet and, like driving in a tiny little car across America. And so, I was dealing with, that came out of nowhere, back pain that wasn't a mechanical injury of any sorts. It was just pain, chronic pain. It got to a point where I really couldn't perform on stage. I couldn't move. I was so stiff. So I went to doctor after doctor. They didn't know what it was, or they would misdiagnose me, which was almost more frustrating. And that went on for years, until finally I saw a rheumatologist who diagnosed me correctly with ankylosing spondylitis, which really saved my life, saved my career, and has just been so important for me. So that's why I'm really committed to now doing everything I can to make it so no one else has to go through this process, which is pretty typical for actually for people with AS. I'm sure Dr. Norton can speak to this. She was also misdiagnosed for quite a while. So what we're trying to do is direct people to monsterpainandtheas.com. You can take a few-minute quiz that will tell you whether or not it sounds like you might have AS, and then direct you to a local rheumatologist. And I wish I had that available to me 10 years ago. Would have saved a lot of time and pain.
Absolutely, and we appreciate you using your platform to share your story with us as well and to help others. Now, Dr. Norton, you're a rheumatologist who also lives with this condition. What advice can you share for others to help them manage this disease from both a professional level and a personal level?
Yeah, as Dan mentioned, I experienced a delay in diagnosis just like he did. And so we're excited to be working with Novartis on this campaign to help decrease the delay in diagnosis for other people so that they don't have to suffer as long without knowing what's going on. So really, I'm passionate about educating people about what AS is. Since most people have had back pain at some point in their lives, AS is often missed, especially in the early stages. AS is inflammatory back pain, which is different than mechanical back pain. This is pain that gets worse with rest and better with activity. It often gets worse in the second half of the night, and people often have trouble getting up out of bed due to severe stiffness. It can affect not only the whole spine, but the hips, buttocks, even neck, and sometimes the heels and knees, other joints as well. So in addition to educating people about what the disease is, with my own patients, I work with them on an individual treatment plan. And this involves not only medications, but healthy lifestyle choices, which really go a long way in this disease. And Dan and I are both very big on exercise on a regular basis, on eating an anti-inflammatory diet, staying active. It's important to avoid smoking because that's known to worsen this disease. And just, to the extent possible, reduce stress, get enough sleep. All of those things are important to work on. So I'm really trying to get people to the attention of a rheumatologist so they can work with them on an individual plan.
That's great information and great tips there. Now, also, doctor, what would you say to someone for getting that conversation started with their healthcare provider to say, hey, I'm having this back pain, but it's not the usual back pain. I think something is off. What else can someone say when they have that initial conversation with their doctor to maybe jog that conversation, spark that conversation that there may be something more going on, such as AS, and to get tested for that?
I think that's a really good question because back pain is so common. So it's important to point out if you think you have inflammatory back pain, which is different. So if you do take the quiz on monsterpainintheas.com, and if it does indicate that you may have inflammatory back pain, you can actually get connected with a rheumatologist through that site. But if you're talking to your primary care provider about getting referred to a rheumatologist, I think it's important to express the concern that you have features of inflammatory back pain, which is different than other kinds of back pain.
Great advice there. And lastly, Dan, tell us what advice do you have, other than everything we shared here today and the doctor shared? What's some advice that you have for men who may be dads, such as yourself, with a busy schedule, who may be experiencing this back pain, and how to manage it just from day to day, even after they get diagnosed with AS?
Yeah, my advice would be, first of all, to know that it's going to be okay. Luckily, there are wonderful rheumatologists that are very knowledgeable and will help you find a treatment plan for yourself. In some ways, I have gratitude towards AS in my life because it keeps me disciplined, it keeps me healthy. I'm able to focus more on my diet and have a little extra oomph to eat right and go to the gym, and so I'm grateful that it's brought a little more discipline to my life. I'm not necessarily grateful for the disease, but I'm grateful for that. So yeah, my advice would be don't fret, it's going to be okay, and see a rheumatologist.
Thank you for sharing that word of encouragement for others. And again, for more information on everything we discussed today, as well as some tips and a test that you can take to see if you may have AS yourself, you can visit monsterpainintheas.com. Thank you so much for joining me today, Dan and Doctor. It's been a pleasure, and best of luck to both of you.
Thank you so much.
Thank you for having us.